In looking at electrostimulation, a recent meta-analysis was conducted and again presented at the American Academy of Orthopedic Surgeons in 2016. And this particular paper was a meta-analysis of randomized sham-controlled trials. Again, this included 15 randomized trials, a total of 1,247 patients. The sample size is up sixfold from a prior trial done about several years ago by the same authors. In fact, using the same methodological rigor as they had in the past. The indications for electrostimulation included spine fusion, fresh fractures, non-union, delayed union, as well as osteotomies. Overall, radiographic non-union was identified to have a 35% reduction in risk with using an electrical stimulation device compared to a sham control. What this means is that for every 7 patients treated with an e-stim device, 1 non-union or persistent non-union could be prevented. This meant it had an NNT of 7. And you can see here from the overall graph or the forest plot, once again, that electrostimulation is favored, similar to what we saw in the radiographic findings in the BMJ paper on low-intensity pulse ultrasound. So once again, we see this, we see the overall acceleration of fracture healing here as well with electrostimulation. But when looking at pain, which is a clinically important measure of outcome for patients, we also identified in this meta-analysis a significant reduction in overall pain scores compared to a sham-controlled device. There was little, if any, heterogeneity, and we felt the data were fairly homogeneous in this. Overall, this meta-analysis, again, just as the BMJ meta-analysis, is a robust meta-analysis with a lack of obvious publication bias, and certainly using a variety of indications.